So this week gives you a chance to learn more about health professions and healthcare professionals that interact with physical therapists and physical therapist assistants. So the objectives of this activity is to learn more about healthcare professions and what they do, uh, and uh, and it's always useful to know who these different members of the healthcare team are, to develop an understanding of their level of education and their scope of practice, so you can use them as resources, and vice versa, they can use you as resources to provide the most optimal care for the individual patient. So how this is going to work is you're going to use the same structure as you did when you did your summary of the readings on physical therapy practice. So you do have a link that you will open up, and in this link you're going to select your topic by typing your name next to the healthcare professional that you want to learn more about and report on to the class in your forum groups. And I do want you to put them in bold font just so they stand out, so people see them. You can use them in their color if you like. You don't have to. And so everybody is going to pick one of these healthcare professionals. And some of these are going to be working, you'll see work more across the board with physical therapists and physical therapist assistants. An example of that would be an occupational therapist or a speech language pathologist. But other professions will still interact with PT. They all do. For example, as you've learned that a neurologist will do imaging and tests to determine the diagnosis of a patient with a neurological health condition and report their findings to the physical therapist, and likewise the physical therapist and the PTA will report observations of patients that they perhaps suspect of having a neurological problem, and the PT will refer the patient back to or to a specialist such as a neurologist. So once you pick your topic, you're going to go back into the actual lesson builder here, and you kind of learn, when things are due. This one, you want to pick your topic before Saturday of next week. I'm giving you some extended time because you do have a lecture or lecture exam in Christina's class, and you also have a skill check in PTA 101 lab. So it's a busy week for you next week, so that's why I'm giving you more time. You'll have until Saturday at 8 o'clock to do your initial post in your forum, which you'll find you'll be staying in the same groups that you did or that you were in the summary reports for physical therapy practice. So if you're in group 1, you're staying within that group. And you can post in other groups if you find a topic that's interesting, such as you want to learn more about physiatrists. You can engage and reply to a post from a classmate reporting on what a physiatrist is. So now you know kind of the basics of the assignment. So you have until Saturday, 8 p.m. to do your initial post. Then you have until Tuesday, the following week, to reply to 3 of your classmates. And so you're probably wondering, well, what do we do now? Well, let's see what the grading rubric looks like. The grading rubric's in different places. The grading rubric is actually within Moodle itself. So you go up to the top and you see where it says rubric. You click that and you'll actually see the health grading rubric. So you're probably still wondering, well, what do I need to do here? Well, what you need to do is with your topic, so let's say you pick speech language pathologist, it's worth 20 points similar to your other forum. You really do want to look for quality in your summary of that healthcare professional. And this would be actually to 3. That's a typo, so I will change that. So your initial post is a strong, credible example of your understanding of the role of a PT-PTA, including examples of applying evidence from the course and connecting the PT-PTA or other sources from the course or other sources, and connecting the PT-PTA relationship to your selected healthcare professional. So how does the PT-PTA work with the speech-language pathologist? And to show clear that you've really thought about your examples and did some research. So you can define the profession, like speech-language pathologist. Who are they? What is their education requirement? How much schooling do they need? What schools in Oregon or Washington can a student attend who is interested in the profession? And when I say schools, if there's more than one school, you'll want to report that. If there's like 14 or 15, you can report that too. You don't have to list all of them, but if it's 14 or 15, such as CNAs, but with speech-language pathologists, there's a small number. So what practice settings does a professional work in? So example, do they work in private practice? A speech-language pathologist works in several settings, actually. And what is their scope of practice? What do they do? What does a speech therapist do? That would be how you enter that. You can list them 1 through 5, but you really want to capture the PT-PTA relationship and how PT-PTA interacts with the selected professional and vice versa. So a lower grade would be you have some examples, it's emerging, you seem to have a fairly good grasp, although it's somewhat vague, and some vague examples of the above just not being complete. For example, you might, in speech-language pathologist, list one school versus the more than one school that exists. Replies, minimum of 3 replies to posts are required, and really providing some substantial feedback to carry on the conversation, and then what you've learned, and then you need to do APA MLA formatting. So in the lesson builder, I also have an example for you, and this is an example of a posting on a neurologist from a couple of years ago. This would be an A paper. So they did some research using some of the tools that I talked about earlier about using the library or how to collect good, solid research. And so here's their source. Here's educational requirement, scope of practice, practice settings. They mentioned that OHSU is the one school. That is factual. Why would a PT-PTA refer to a neurologist? And then the scope of practice. Then they have a list of references. So I really want you to have fun with this assignment and learn, and I really look forward to your post. I have in the past allowed students to actually submit an exam question for the Unit 3 exam based on their healthcare profession, and that has really kept students engaged, and I generally get 4 or 5 students that submit questions. So we'll talk about that as we get into next week.